Hello, so I just want to make a video about how my top surgery results are at the moment and about various other bits and bobs in my life. So I'm 3 months and 2/3 post-op, I think. I think I'm probably 3 months and 3 weeks post-op. And I'll be honest, I'm not completely happy with the results at the moment, because as time's gone on, the things that I was kind of feeling a bit bothered about in the beginning have become more and more pronounced, like this dog ear over here, and the excess kind of, I'm left with, I don't think this is necessarily excess, but I'm left with this kind of dent here, and also I've got quite a lot of overhang over here. I mean, it's not a massive amount of tissue. You know, some days I'll look in the mirror and I'll be like, oh my god, I look like I have massive boobs. But then other times I'll look and I'll be like, well, no, there's a little bit of excess tissue. When I tense up, it looks just a little bit better, and you can see exactly where the excess tissue is, which is essentially this area here has some excess, and this area here as well. And there's this thing where it kind of dips in a little bit on both sides, but there we go. And I think I just wanted to share how I was feeling about that, because looking around at various resources, various trans resources, different video blogs, YouTube channels, written blogs, photographs, etc. You know, the vast majority of trans guys are posting pictures of, completely flat chests, and they're, going on about how completely happy they're feeling with the results and all of that stuff. And that's not really been my experience so far. I mean, I'm not completely unhappy with the results. I just think they could be a little bit better. That's all. I'm still really happy with my scarring on this side. The scarring, on both sides is really quite minimal. There's the dog ear here, but that's not a great deal. It can be easily dealt with. The puckering is still there on both sides, but it's reduced quite a lot since I had the surgery, and this scarring and the scarring around both of my areolas are really good. The main thing that's bothering me essentially is this little overhang that you can see here, and this bit here, but they're not terrible, and as I said, sometimes I'll look at them, I'll look in the mirror and I'll have a really unrealistic, very negative view of my chest, and then other times I'll look and I'll be like, oh, actually I look quite good, I'm quite happy with it today. So I think it's just a process. One thing that's really been helping kind of with my shoulders and my arms and putting the rest of me back in order, kind of getting back to my usual level of fitness, has been swimming. I haven't been that many times. I've probably been about 4 times, and I just go once a week, and that's really helped me with my confidence again, and stuff like that. I finally feel well enough and strong enough in myself to kind of start working out at the gym as I normally would again, which is really great, because I really think that going to the gym will make a big difference, and doing some work on reducing kind of, because I quite like my tummy, I don't mind it, but I know that it's a little bit, it's there. So I think if I generally reduce my overall fat and work out my chest to add some bulk, then that'll even this out a bit, because what's essentially happening is that my muscles here, my pectorals, are underdeveloped, so that's creating this dipped shape, and I think that working on my chest and my upper body, kind of all of me really, will really help with that. So although some days I'll wake up and I'll feel really horrible and feel really self-conscious about it, today's one of the good days when I don't feel so bad, and when I actually think, well, actually, it looks great. And it tends to look worse to me when I look down on it, and that's generally when I had breasts. That's when they looked bigger to me, is when I looked down. So I think that's just an unrealistic point of view, because they're right there, and so they look bigger to me than they do to anybody else. So yeah, the other great thing is that I've got sensation back. I have pressure sensation everywhere on my chest, and I have sensation along my scar and on both of my nipples. I'm starting to get erotic sensation back as well. It feels different to how it was pre-surgery, but it's still some kind of erotic sensation. It's just a bit weird to get used to. So yeah, I think we'll see what happens with my chest. I feel quite okay about it today, and I've also found a couple of people online that have had a similar experience to me with their surgery, which I wasn't finding for quite some time, and that kind of made me feel a little bit isolated. But as I said, I've found people that have had a similar experience now, which has really helped me. What else is going on in my transition? I've just got my little list of things that I wanted to talk about. Other things in my transition. So generally, with regard to physical stuff, I'm quite late on taking my testosterone, but I found out what my testosterone levels actually are, which they are 13 nanomoles per litre, and that's after not having had an libido injection for 4 months. So apparently, that's all fine, and all of my hormone levels are completely normal, which is really great, because I hadn't had my healthcare hasn't been very consistent, and I haven't actually had a set of blood tests done since my first 3 months on testosterone, and I've been on testosterone now for about 2.5 years. So that's not very good, but I'm completely healthy and completely fine. My current GP is quite alright. The doctor is alright. The actual GP surgery is quite rubbish, but the one doctor that's dealing with me with regard to my kind of ongoing transition's been really fine. He's happy to prescribe testosterone, but just wants me to be referred to Charing Cross and be seen by the doctors there, just to have me under the care of, I suppose, a specialist, really. So that's all going really well. So generally I feel quite happy with the results of my transition, my top surgery. I feel quite happy with the results of my transition as well, because it's it's changed my life. So one thing that I'm feeling quite self-conscious about at the moment is being around other trans guys without my shirt on. It's not something I've had the opportunity to do, and I'm quite nervous about when the opportunity arises, because I just have this impression that trans guys are going to be the ones that notice the imperfections in my chest, but that's probably not going to happen. It's probably all in my head, but it is just something that I think about, I suppose. So yeah, I think I'm going to leave it there. This might have made no sense whatsoever, but we'll see.